All right, so we got Gary has been diagnosed, all right, with acute inflammatory demyelinating polyneuropathy, or AIDP. The condition has progressed to the extremities and the trunk. The patient reports significant shortness of breath at rest. Which of the following additional findings is the most anticipated? So we have A, vital capacity of 5.25 liters. We have B, which is increased residual volume. C is FEV1 over FVC equals 0.65. And then we also have D, which is FEV1 of 85%. All right, so in order for you to get this right, have some confidence about this, obviously we have to know a bit about what this AIDP is, understand pulmonary function test a bit, and lung volumes and how all those relate. So let's go ahead and start dissecting this one. So we have Gary, right? He's diagnosed with this AIDP, acute inflammatory demyelinating polyneuropathy. Okay, a mouthful, right? All right, this is the time, baby, that you have to be able to dissect this and come to a determination as to what is this pathology? What is this? This may or may not be something that you've seen before. All right, but I will tell you, as you dissect just the parts of this condition, obviously it's acute, obviously it's inflammatory and demyelinating, but let's think about that for a minute. What do we mean by demyelinating? Right? We know that there's a myelin sheath around the nerves, right? And if there's demyelination, we know that there's not very good nerve conduction, which leads now to this polyneuropathy. Okay, great. So what is this condition really? Like, what are we really talking about? Easily stated, it's Guillain, however you want to pronounce it, whether you're Europe or United States, don't matter. Guillain-Barré. All right, GBS, as they call it, Guillain-Barré syndrome. So that's what we're dealing with, and that's probably what you're more familiar with. Now, as we continue down the question, it says the condition has progressed to the extremities and trunk. Well, isn't that consistent with GB? That we have that kind of like wash-in syndrome where you have glove stocking distribution. It starts in the feet, maybe starts in the hands a bit as well, and then progresses towards the trunk. All right, so it encompasses both the extremities and the trunk. Don't we see that? All right, so let's continue on down the line. It says the patient reports significant shortness of breath at rest. Well, with Guillain-Barré or Guillain-Barré, as it progresses, we know that it affects the respiratory muscles, which can cause shortness of breath. So all this is just supporting what I already know. It's not any new facts, really. All right. So we get down into the question stem. All right. This piece right here. And it says, which of the following additional findings would we expect? Now, you have to make this determination right now. Is GB a restrictive condition or is it obstructive? Go ahead, baby. Talk to me right now, y'all. Come on. Is GB a restrictive condition or is it obstructive? I need y'all to hit it. Go ahead, put it down right now. I got to see y'all. I see you, Garrett. Janine, Kristen, hit me with it. Is this obstructive? Is this restrictive? I need to know. All right, because that is really going to dictate what our right answer is going to be. All right, so you should be saying that right now, GB is a restrictive condition. It's restrictive. And why is it restrictive? Well, if those muscles cannot contract very well because they've lost their nerve conduction. All right, they're not able to contract with enough force. They're not able to do their job. Well, what happens? We have difficulty with inspiration. It's a restrictive condition. All right, so let's go down to our answer choices because we need something that's going to be consistent with the restrictive condition. That's it. So vital capacity, first thing that you need to know. Well, hold on a minute. What is normal vital capacity supposed to be? All right, we should be sitting at about a 3.5 to 4.5, somewhere in there. Total lung capacity is usually anywhere up closer to the higher 5 number, maybe even to a 6.4. It just depends if you're male or female. So the fact that vital capacity is up that high is not consistent with restrictive. It's not consistent because well, the person's vital capacity is actually going to be, if anything, decreased. They're not going to be able to inspire as much. And so instead of 5.25 liters, we should actually see that thing starting to drop closer to 3. All right, it may be going below 4 liters. The fact that it says 5.25 lets me know that, that's not restrictive, baby. That's way too high for that. And so we can go ahead and eliminate A already. All right, so that just boils down to you understanding, well, what is normal vital capacity? All right, and what do I expect with a restrictive lung condition? We expect it to be decreased or less. All right, A is out. Let's look at B. Increased residual volume. Now, a lot of y'all knocked this puppy out. Y'all in the beginning knocked this out because you know that, well, increased residual volume is seen with someone who has air trapping. All right, so what's that with, y'all? Talk to me. Where do we see air trapping? Where do we see that type of, condition happening? And what pathology? You should be saying, well, I could see that with emphysema. That's number one. I could potentially see that with chronic bronchitis. All right, but those are obstructive conditions. And so you'll see increased residual volume with obstructive, not restrictive. All right, so we can already get rid of that. Are y'all starting to see a little pattern here? That all we're really trying to do is determine which one of these is more obstructive and which one of these is more restrictive. That's the game that we're playing right now. All right, let's go down to C. C says FEV1, which is forced expiratory volume in 1 second, the amount of air that you can expel or expire in 1 second over your forced vital capacity. And that's the total amount of air that you can expire after a full inhalation. All right, so it's saying that is 0.65. Well, we know from literature, if you grab your Ellen Hilligas book, if you go through there and you're looking at restrictive and obstructive lung conditions, you know that FEV1 over FVC, if it is less than 0.70, that is characteristic of a obstructive condition, hands down. So if FEV1 over FVC is less than 0.70, it's obstructive. So what's that telling y'all already? What's that telling you already? That C is not the right answer because that is saying obstructive. All right, check it out. Ellen Hilligas, cardiopulmonary for PTs. That's where you can find that information, all right? So C doesn't fit. But, all right, so we're left with D, but that doesn't mean nothing. Hold on a minute. Let's make sure that we look at D and make sure that we're comfortable with this answer before we move on. So it says FEV1, the amount of air, the maximum amount of air that you can expire in 1 second of 85%. Is that consistent with obstructive or is it consistent with restrictive? And I will tell you this. All right, when it comes down to obstructive conditions, you typically will see that the amount of air that you're able to get out in 1 second is less. We're not able to get out as much air in 1 second. And so you see that the percentage actually will decrease. Start to see it go 70 and 50 and 30, depending on how bad the obstructive condition is. Now, the higher the number is telling you that, well, this person's able to get out that air pretty quickly. There's nothing obstructing the problem or nothing obstructing the air getting out. And so what is that? Well, that can either be normal or that can be a restrictive condition. All right, one of the two. And so the fact that it says 85% lets me know that this is more consistent with a restrictive problem than it is with an obstructive problem. And so we can get rid of A, B, and C, and our final answer is D. Now, if you are stuck here a little bit, you're kind of like, okay, well, FEV1, it's 85%. I see why it's or why, the lower percentage would be obstructive, but I'm not really seeing why I would have a higher percentage with restrictive. Like, I don't get that point. Why do I see a higher number with restrictive? This is what I want you to think about. If you had, let's see if hopefully my head doesn't cut this off. I got a big head and everything. If you had this cylinder right here, All right. And this cylinder was all the air that you can actually breathe in. Right. And so let's say I cut that cylinder in half. And now your cylinder is only this big. Right here. That's all. That's how much air that you can actually inspire and expire. That's it. All right. So here's the deal. Do you believe that you're going to be able to get more of that air out now in 1 second? The answer should be yes. I should be able to get more of that air out in 1 second because there's less. There's less to get out. So of course it's going to be a higher percentage because now I'm able to get out a lot more air because there's not as much air inside the lung tissue anymore. All right. And that is the reason why you see that higher number, the 85%, or it could be 90% or 95. That is more consistent with a restrictive problem, not an obstructive one. Again, always think about that. If I see that the FEV1 is a lower percentage, I know that the person's having difficulty getting that air out, and that's more of an obstructive condition. However, if I have that percentage and it's really high, 85, 90, 95%, I know that that's more consistent with restrictive because the person doesn't have as much air to even inhale or exhale. It's a shorter volume because they're restricted, right? And so that is why we have FEV1 of 85%, the reason why that's the right answer, and the reason why it goes with the restrictive lung condition. The answer here is D. Congratulations to those of you who got this question correct. Congratulations. For those of you who didn't, now you see that these types of questions aren't really that difficult as long as you're able to pull this out into obstructive and restrictive. You don't even need to know much about GB or acute inflammatory demyelinating polyneuropathy. You don't need to know much about that. Long as you come to the decision of, okay, all I need to do is determine which of these values or which of these answer choices goes with obstructive and which one goes with restrictive. That's the only thing I'm really asking you to do in this question. That's it. Bottom line.